Hello friends, today we will be concluding the series of General Pathology and Homeopathy. So today's point is the sixth point which we'll be taking up. Pathology helps to determine the remedy reaction or response. So out here, I'll give you a few examples of certain remedy reactions as per Ken's lecture, and let us see what relationship it has with pathology. So let us take the third remedy reaction, that is homeopathic aggravation. So it can be defined as a sharp, quick, and short aggravation with a sense of well-being. As per Organon reference, aphorism number 154. Though the symptoms are aggravated, the patient will say, I feel better. So this is very important. Though the patient's symptoms are worse, he'll tell you, doctor, though my symptoms are worse, but overall, I have a good feeling, or I feel good, or I feel better. So, where there is no tissue change and only functional disturbances are present, then you may expect the remedy to cure the patient without any serious aggravation or without any sharp suffering. So, in a homeopathic aggravation, it will occur in those cases where there are no tissue changes, or even if tissue changes are there, they are reversible. So, in short, they are reversible pathology with functional disturbances. So, in such cases, if your remedy is correct, it is given in the correct potency, and if it is judiciously, then you may get such an aggravation. Whereas in a chronic disease, there are no tissue change, you may not get aggravation at all, unless perhaps it is a very slight exacerbation of the symptom, and the slight exacerbation of symptom is of a different character. It is established on the remedy as a new disease upon the economy. So what happens in a chronic disease? In a chronic disease, especially where the pathology is there and it is reversible, the natural disease is there, which moves forward, and the signs and symptoms are exhibited. Then you are collecting the totality and you're prescribing the similimum with the correct potency and judicious repetition. And then what happens when you administer the remedy to the person? An artificial disease is created. Now this artificial disease will try to combat the natural disease, and it will move at a faster speed as compared to the natural disease. It will overtake it, and now the organism will be under the influence of the artificial disease. So when the artificial disease overtakes the natural disease, naturally there is bound to be some sort of an aggravation, because the artificial disease is slightly stronger than the natural disease. Now, why does this occur? Because in homeopathy, if you are using the centesimal scale of potencies, we have the 6C, 30C, then after, so between 6 and 30, we don't have any intermediate potencies. Also with 30 to 200, we do not have any intermediate potencies. So basically what will happen, this aggravation takes place because we don't have any intermediate potencies to exactly match the state of the natural disease. So that is why this sort of an aggravation takes place. However, it can be remembered that if the potency exactly fits in with the natural disease and it synchronizes with the natural disease, then naturally you will directly get amelioration. There will not be any aggravation. However, this is quite difficult to achieve, but if you are lucky, you may get such an reaction. However, in cases which are suppressed, especially true for chronic diseases, when the right medicine is given, you will notice that an elimination will take place either through the bowels or the stomach, through the bowels like say form of diarrhea, or from the stomach by vomiting, or from the respiratory tract, say for by expectoration, or from the kidneys by profuse urination. So if this sort of an elimination takes place, it's a good sign that your medicine is active and the suppression is coming out. Second example is a prolonged aggravation with final decline in health of the patient. It is also known as killer's aggravation. This is Kent's remedy reaction number 1. So out here, the killer's aggravation or a prolonged aggravation takes place, and ultimately it will lead to the death of the patient or final decline of the patient. Why? Out here, number one, the physician has done a mistake. So there's a mistake on the part of the physician. He has administered a remedy, or let us say an antipsoric remedy according to the case, which was too deep and it has established destruction, and therefore the patient's health steadily declines. So, why did such an error occur? It occurred because the physician did not realize that in this case, what he was treating, the pathology was gross in the organs and the destruction had taken place, or in other words, the pathology was irreversible. So, in such instances, when the pathology is irreversible or there is gross destruction of the organs which are taking place, the similimum what you have given was given in the high potency and it may be repeated too frequently. So therefore, you'll get such an killer's aggravation. So you have to remember, number one, that in such instances, you do not have to give the high potency. Not only that, the most important point is that the physician should be knowledgeable. He should understand that he's on the wrong track. He should be able to identify this reaction. Then only he'll be able to be successful in practice and avoid such errors. So, what do we do in such cases? As I told you, the physician should be knowledgeable. That is utmost importance. Until he has the knowledge, he will not be able to identify such an reaction. So, first identify the reaction. Then what do? We immediately stop the homeopathic medicine. Then you can administer an antidote. Antidote can be administered in two ways. Number one, whatever remedy you have given, you can open up Borix Materia Medica and see the remedy relationship table of the Gibson Miller, and under the antidotal heading of that remedy, see which remedy fits the patient well, an antidote. Or you can also use the universal antidote like Nux vomica, Coffea cruda, and Camphora. After administering the antidote, you again retake the case. So after you antidoted the case, and therefore the side effects or whatever bad effects have taken place may reduce. So therefore, what do? We again have to retake the case and see if the previous totality still holds good. So after you've retaken the case, you see whether there is a new totality or you see if the old totality still holds good, and accordingly give the medicine. The medicine should be given in low potency, say for example 30C in infrequent repetitions. Third example can be full-time amelioration but no special relief to the symptoms of the patient. This is also given in remedy reaction number 7. So when will this sort of an amelioration occur with no relief to the patient? Out here, the pathological changes are there, or there's gross alteration in the organ, or there's irreversible pathology, and you had administered the similimum in the correct potency and judicious repetition. So out here, we have an incurable case, and whatever medicine we are administering will give the patient temporary relief or will act as palliation. So palliation can be defined as the temporary relief of the patient without much affecting the state of susceptibility. So that means as long as the patient is under the influence of the similimum or the indicated homeopathic medicine, the patient will have relief of symptoms, his suffering will be less, his life will improve, his quality of life will improve, and also his age expectancy may improve. So the patient should continue this medicine in order to get good relief. However, if by chance the patient stops the medicine or has forgotten to take the medicine for quite some time, then it will so happen that whatever symptoms are ameliorated under the influence of that stimulant, again the symptoms would resurface. And again the pathology would also advance. So in such cases, the patient has to be under the influence of the homeopathic drug. It depends upon many factors like the speed of the disease, the depth of the disease, the miasmatic activity, the state of susceptibility, the general condition of the patient, and so on and so forth. So, on all these factors, the repetition will depend whether to give single dose stimulation or multiple dose stimulation and how long to give it. So, the emulation of the case had existed often the full length of time of the remedies, but the patient has not risen above his own pitch in the length of time. As I told you, though the patient has been ameliorated, the patient still remains at the pathological level at the same plane. That means with our medicines, we may be able to arrest the pathology, or the pathology will slowly increase because it is an irreversible case. We cannot do much except for giving some temporary relief to the patient. So out here, the remedy acts favorably, but the patient is not cured and can never be cured. The next point is pathology helps to determine the homeopathic posology. So the condition which influence the choice of the dose depends upon the state of susceptibility. So basically, homeopathic posology will depend upon the state of susceptibility of the patient. So let us see how can we decipher or how can we assess the susceptibility at the bedside. So there are 7 points on which you can assess the susceptibility on the bedside. Number 1, nature of disease, symptom exhibited, suppression, type of pathology, miasm, sensitivity of the patient, both on the mental and physical level, and the general condition of the patient. Before going into details of all these 7 points, please remember that susceptibility has to be assessed by an summation of all these 7 points. I repeat, by an summation of all these 7 points. You cannot take up one point saying that symptom is characteristic, so the susceptibility is high, so I'll give a high potency. No, that will be wrong. So a summation of all these 7 points have to be taken. Now let us see, and then only we can decipher whether the susceptibility is high or low. I will explain to you this as we go forward. First one is the nature of the disease. So let us deal with an acute disease as well as the chronic disease. In acute disease are the result of sudden explosion of latent sora which lies dormant in the individual. So Dr. Hahnemann has said that the sora lies dormant, lies quiet, or is sleeping, or is slumbering in an individual, or in short, it is inactive in an healthy individual. Well, under favorable environmental conditions, the dormant or the latent sora or the slumbering sora or the inactive sora, it gets activated and the symptoms are thrown out. So you get you have a host, and the host is bombarded with these environmental factors like physical factors, chemical factors, biological factors, and psychosocial cultural factors. So these factors constantly bombard the individual, and what happens initially, the vital force will be strong. It will avoid these noxious influences. But as I told you in my previous lectures also, when there is a failure of adaptation, the disease will set inside. So the vital force initially adapts to the inimical influences and wards away the inimical influences. But later on, it fails. There's a failure of adaptation. Vital force gets weak and succumbs to the disease. So what happens? When the noxious influences are more powerful than the energy of the vital force, they will activate the dormant or the latent or the slumbering or the inactive sora. And this gets activated. And once it gets activated, it's like a volcano. It can be compared to a volcano which erupts up with great intensity. So therefore, generally speaking, in acute cases, all the symptoms which are exhibited will generally be characteristic in nature. So therefore, thus in most of the acute cases, the symptom exhibited will be characteristic, hence the susceptibility will be high. And of course, in chronic case, it will vary. In a chronic case, it will depend upon the symptom also which have been exhibited. So if a common symptoms are exhibited in a chronic case, you know the susceptibility is low, and this will occur especially in advanced pathological cases where you will get symptoms which are diagnostic of the disease. And if the susceptibility has been suppressed or hampered or tampered with, naturally you will not get any characteristic expressions of the individual. Whereas in a chronic case where there is functional disturbances or the pathology is there, but however, or luckily it is reversible and the susceptibility has not been much hampered with or suppressed, then naturally the symptoms which are thrown out is a mixture. Number one, of the common symptoms. Number two, of characteristic symptoms, both at the mental and the physical level. So you will see here the common symptoms will be diagnostic of the disease, and the characteristic symptoms will be diagnostic of the indicated homeopathic remedy based on the totality of symptoms. So now what I am telling you, there are no hard and fast rules. It has to be moved according to the case. Now, as I told you, in acute diseases, the susceptibility is generally high. But it can so happen that in acute disease, the susceptibility can also be low. Why? Because if suppression has taken place, patient has taken allopathic medicines, it has suppressed the phenomena of the disease, then naturally the expressions also would be blocked. So in such instances, you will only get maybe only a few characteristic symptoms or none at all, because mostly there'll be common symptoms. So these rules, what I'm telling you, they are just general rules. These are not hard and fast rules which have to be followed, but they have to be moved according to the case in hand. Now, symptom exhibited. As I told you, in acute diseases, the symptoms will generally be characteristic in nature, hence the susceptibility will be high. However, if there is suppression, there will be paucity of symptoms or only common symptoms which will be exhibited, indicating susceptibility is low or poor. So this point has to be taken in conjunction with point number one, with the nature of the disease. That means what? In nature of the disease, you're getting acute, and the symptom exhibited, you're getting characteristic. So both of them have to be taken in order to have some conclusion. So if the disease is acute and the nature of the symptom exhibited is characteristic, therefore we can conclude susceptibility is high. If the disease is chronic and if the symptoms are common, therefore we can conclude susceptibility is low. So in a chronic case, it will depend upon the character symptom exhibited and the nature of susceptibility. So as I just told you, in a chronic case, if suppression has taken place, symptoms exhibited will be poor. And if no suppression has taken place, symptom exhibited will be characteristic in nature. So again, you have to move this according to the case in hand. But these are just general rules, I repeat, keep them in mind. Now, suppression. So if suppression is present, the symptoms will be of less intensity, or only common symptoms will be there. So naturally, if suppression is present, the natural expression of the vital force cannot be expressed. So as a result of which, what will you get? You will get very scanty symptoms or very less symptoms or symptoms of a less intensity, or only common symptoms will be there. This indicates that the susceptibility is low. In absence of suppression, the symptoms will be marked or of a high intensity, or uncommon characteristic symptoms will be present. Naturally, if suppression is not there, what happens? The susceptibility is not tampered with. The vital force can throw out the expressions which are of a higher intensity, or which are peculiar, rare, queer, strange, uncommon, and characteristic in nature. So please remember, this point of suppression can be compared with point number two, symptom exhibited. Suppose you're confused whether you're right or wrong. So you have to just see this point of suppression. So suppose you have written it is an acute case, the symptom exhibited a characteristic, and you say there is history of suppression, then you will be wrong. Why? If there's a history of suppression, then naturally symptom exhibited will be poor, and in an acute case generally the symptom exhibited a characteristic, but in this case it is poor. So therefore you can again cross check whether you're right or wrong. Now next point is the type of pathology. So here you identify the state of pathology and determine whether there are only functional changes or there are structural changes or the changes in the part, location, or the organ is advanced. In cases where there are only functional or reversible changes, the state of susceptibility will be high. And advanced pathological changes or where there is irreversible pathology, the susceptibility will be generally be low. So again, there's no watertight compartment. It has to be moved in the according to the case. So in a case of advanced pathological change out here in this last point, where there is irreversible pathology, generally the susceptibility is low. But if the susceptibility is good enough and if the patient throws out symptoms in spite of an advanced pathological irreversible pathology, the symptoms exhibited are characteristics. Therefore, we say the susceptibility is high. So this is how everything will change. I repeat again, these are general rules, have to be moved according to the case in hand. Next point is the miasm. So we have to see the miasm. In acute disease, the type of miasm will depend upon the state of susceptibility. Here we have to give importance to the presenting miasm or the dominant miasm of the case. So in acute diseases, basically, we only take a short history of the chief complaint. Therefore, the chief complaint is also known as the dominant. From the chief complaint, we can find out the dominant miasm or the presenting miasm. So this will be identified by evaluating the chief complaint of the patient. Thus, if the dominant or presenting miasm is SORA, the susceptibility will be high, psychotic low, syphilitic, it will be extremely poor or low. So in acute disease, we're just taking in the LSMC form, seeing the presenting miasm, and then we can determine the state of susceptibility. Whereas in chronic disease, the miasm will, in chronic disease also, you have to identify the state of susceptibility. So how will you do that? That will be given or seen by giving importance to the family history and past history in order to understand how identify the fundamental miasm. So in a chronic disease, we are identifying the fundamental miasm, whereas in an acute disease, we are identifying the presenting or the dominant miasm. So in a chronic disease, from the family history, we can come to know what is the fundamental miasm. That means what is inherited from the family background. We will be in a position to know. And furthermore, the miasm or the fundamental miasm could be single or complex or in different permutation and combination. So the patient may just have a low miasmatic load in the fundamental miasm. So he may be having one miasm, either of SORA, psychosis, or syphilis, or complex miasm meaning a combination like psychosis, psychosyphilitic, etc. And this can come in different permutations and combinations. You may get syphilitic, psychosyphilitic, syphilitic, or all the three miasms, psychotic, and syphilitic. So out here, you have to evaluate correctly the fundamental miasm, especially when a complex miasm is there. So when a complex miasm is there, suppose the patient has a complex miasm of psychotic. So out of these two, you have to see which is more predominant. Is the soric miasm predominant or is the psychotic miasm predominant? So accordingly, you have to grade it. You can write SORA +3 oblique and psychotic +2. So out here, you know, initially the soric activity is greater than the psychotic activity. So this will be able to identify the miasm and it will help you in the prescription. Next point is the sensitivity on the mental and the physical level. So how do we determine the sensitivity? Naturally, by the types of symptom exhibited on both levels, that is the physical level as well as the mental level. Hence, in a case, if we get more peculiar or characteristic symptoms, it will indicate a high level of susceptibility. So suppose the patient is sensitive enough, he's exhibiting more and more symptoms on both the levels, then naturally the symptoms may be of a characteristic in nature. Or on the other hand, the number of common symptoms is more than the characteristic symptom, the susceptibility will be low. And however, if the patient is not so sensitive enough, he may not exhibit the characteristic symptoms, but he will only exhibit a few common symptoms. This will indicate the susceptibility is low. So out here, in short, the type of mental symptoms and the type of physical symptoms will determine the sensitivity of the patient, whether it is characteristic or whether it is common at both these levels. The last point is the general condition of the patient. Here, we have to assess the overall condition of the patient. So, overall condition, how is the patient? How is he feeling? What does he look like? Is he thin? Is he fat? What is his build? How is his orientation? Is he conscious? Is he unconscious? And his vital parameters. So the general condition can be assessed by looking at the overall condition of the patient. That means what? First and foremost, you have to assess the state of consciousness, reaction to time, place, and person, and also examining the vital parameters of the patient. Like you all know, the TPR, BP. If found normal, then we can conclude that the susceptibility is not hampered. So if the vital parameters are normal, patient is conscious, we know that the susceptibility is not hampered. However, any abnormal exam finding may indicate a state of low susceptibility. Suppose you find patient is unconscious, he doesn't respond to time, place, and person. He sometimes responds only to deep stimuli. There's tachycardia, tapnea, and there's hypotension. So out here, we'll definitely come to know that the general condition of the patient is very poor, or in other words, the susceptibility is very, very low. So now we have to take a summation of all these 7 points, and we have to come to a conclusion whether susceptibility is high or low. So out of all these 7 points, suppose we have 5 points in favor of high and 2 points in favor of low. So overall, we know that the susceptibility of this patient is high. So you have to work it out in the hands of beginners who have just passed out, or students. If you find this difficult to remember, write it down on a piece of paper and accordingly solve it when the patient comes to you. As you gain experience, this will automatically come to you without any problem. So I repeat, a summation of all these 7 points has to be taken into consideration. You cannot say the susceptibility is high because of age or sex or occupation and all that. All right, these are the important points which have to be taken into consideration. Next point, pathology helps as an index to select the remedy. So pathological prescription is important at times, because what happens, sometimes we get only common symptoms indicative of the diagnosis of the disease, and we may or may not get characteristic symptoms. So what to do in such cases? Therefore, pathological prescription is important. It is used in cases where the remedy is not evident to the physician, or it becomes difficult for the physician to perceive the correct remedy because of lack of symptoms. Out here, we only get common symptom of the disease, which is useful for the diagnosis purpose, with a very few characteristic symptoms. And these characteristic symptoms may or may not be also present. So therefore, as a pathological prescription, what can we use? We can use rare remedies, organ remedies, nosodes, bowel nosodes, and cancer nosodes. So these are the weapons whereby the physician can combat the disease, especially where in cases of advanced pathology, when you get more pathological symptoms and less characteristic symptoms. Now let us see one by one. Rare remedies. In homeopathic practice, we meet with situations where prescribing becomes difficult owing to insufficient data for prescribing a polycrest remedy. So as I told you, in pathological case, you only get pathological symptoms and you may or may not get any characteristic symptoms. So what are we getting? We are getting an insufficient supply of symptoms in order to prescribe on. So rare remedies often play a useful role in such cases and do an excellent job. They are called rare as they are not known or prescribed by majority of the physicians. And yet, The indications for their use are given in various materia medica. So if you see our Borix materia medica, there are very small, they are remedies which have only around 8 to 10 lines, that's all. And in these 8 to 10 lines, there is 1 or 2 lines which are written in italics. So these are confirmatory symptoms on the bedside which have been confirmed. And these are known as rare remedies. Why? Because they exhibit certain characteristic symptoms, and the symptomatology of the drug is not very extensive or not very vast. And these rare remedies may not be known to all physicians, therefore they are rare. For example, anagalis in the right-sided trigeminal neuralgia, more helpful in mandible nerve neuralgia of both sides, which is aggravated by coffee, or asparagus for a salivary calculi, or aspidosperma in cardiac dyspnea. Generally, we give this in mother tincture form, or Auramure natronatricum for fibroids, or Fraxinus americanus for fibroids. Also, this we give in mother tincture form. Sanicula for offensive and acrid leukorrhea, Antipyrinum for chain stroke respiration and angioneurotic edema, Agralis for locomotor ataxia. So these are a few examples of rare remedies. Now let us go to the organ remedies. So organopathic is a form of treatment where, unlike in classical homeopathy, case taking the locality of the symptom expressed and the relation to a specific organ determines the remedy to be selected. It is based on the assumption that certain remedies have specific affinity for certain organs, and it becomes necessary to treat these specific organs or systems in order that the whole person may be cured properly. So it originated from folk medicine. It was improved upon by Paracelsus, Rademacher, and James Compton Burnett. They gave homeopaths a new approach to identify the remedies and their prescribing. The locality of the disease, the so-called specific seat of disease, become a principal indicator for prescribing. So out here, we give importance to the location. For example, if the brain and the nervous system is involved, we can give Avena sativa or Kali Phos. If heart complaints are there, you can think of Retigus or Cactus. If digestive organs are there which are involved, or digestive disturbances are there, alpha-alpha or hydrastis. For liver and gallbladder conditions, Chelidonium cardus marinus. For urinary organs or affinity for the urinary organs, for the kidneys, you can use Berberis vulgaris, or for the bladder, you can use Equisetum. So in a case, again, where the symptoms are not very prominent, you just get a patient having pain in the right side or in the right iliac fossa, or from the right renal angle going to the right iliac fossa, going down to the leg, aggravated by the slightest touch and or the jaw. So, and the patient is not giving much other symptoms in order to prescribe, and he gets the report saying that there's a right uretic calculi. So out here, if you're not confident of prescribing the correct medicine because of lack of symptoms, then you can go on to this organ remedy and give Berberis vulgaris in the mother tincture form. Or for tumors of the breast, Phytolacca is useful. For ovaries, Folliculinum is useful, especially where there is PCOS. A few doses of Folliculinum could also help the case. In prostate troubles, Thuja, Conium, or Sabal cerulata can be used. For blood disorders, echinacea, gunpowder, pyrogen, and bacteria can be used. So echinacea, as you all know, is known as the homeopathic antibiotic, whereby it disorganizes the blood and there's an increase of WBC count. Gunpowder can be also used for wounds which do not heal, and also for right-sided orbital neuralgia. For skin, you can use Berberis equifolium. Disorders of the veins, say varicose veins, hemamelis, vipera, calcareous floor, or ailments of the bones or or diseases affecting the bones, you can use symphytum, ruta, hecla lava, and so on and so forth. So symphytum is generally used for the fractures. It helps to unite the fracture fast. Ruta may be used for bone pains, and hecla lava can be used for exostosis. Now, nosodes. They are made from disease products of human or animal origin, or from the pathogens, or from products derived from the decomposition of animal organs, cultured microorganisms, or body fluids containing pathogens or pathological agents. So, in short, nosodes are disease products. And these are useful in treating, whereby you are not getting much peculiar symptoms. So, in case of urinary tract infection, where a culture has been done and sensitivity has been done. In culture, you find that E. coli is present above 1 lakh, which is of significance. So in such instances where the patient basically may not have any symptoms of burning or frequency, and he has this chronic urinary tract infection where E. coli is present, directly you can give E. coli and it gives you a fantastic result. Also for gallbladder stones, you can use Feltaury. For sore throat, Oscillococcinum can be used. So these are a few examples of nosodes. Now let us go to bowel nosodes. Although the bowel nosodes were brought into being during the early 1930s, there was not much attention being paid to this group of nosodes after the initial experiments by Edward Batch and John Patterson. Essentially, bowel nosodes are prepared from cultures of non-lactose fermenting flora of the intestinal tract. They are not the morbid products of disease, but they come under nosodes. Edward Bach, he was a bacteriologist in London, discovered that certain intestinal germs belong to non-lactose fermenting gram-negative coli. Typhoid group has close connection with such chronic disease and its cure. These germs present in healthy and diseased individual, but in the later case, it is pathogenic. He isolated the bacillus and gave back to the patient in the form of vaccine, an autogenous vaccine, and he claimed to cure the disease. Later on, he patentized the vaccine according to homeopathic principles and administered, cured so many patients. First fully prepared of clinical proving was done in 1929 by Thomas Dixington on the remedy Dicentrico. In 1930, Batch briefly summarized clinical derived indications for most of these nosodes. And in 1930, he stopped the research on bowel nosodes and discovered black back flower remedies. Now there are 12 bowel nosodes: B. Morgan, Morgan Pure, Morgan Gartner, Dicentrico, B. Proteus, Gartnia, Psychotico, Bacillus number 7, B. Mutable, B. Fecalis, Bacillus number 10, and Cocal Co. So let us see some examples of the bowel nosodes. So Dicentrico, it has action on the pylorus, causing causing spasms and retention of the digestive content. So out here, it has been seen there's a marked improvement in congenital pyloric stenosis also with this remedy. So Psychotico is also useful for bedwetting and warts. So in some cases, you try your best to relieve the suffering of bedwetting or warts. Patient may present characteristic symptoms. You are giving the constitutional remedy. You have given many remedies, but there's no response. So in such cases, also think of Psychotico. It gives you good results. Bacillus number 7, it could be used for spongy gums, cannot digest egg and fat, greenish fish-filling leukorrhea, numerous flat warts on the hands, and useful for lipoma also. Now, the next point is the cancer nosodes. So epitheliomine, extract of epithelioma. Scirinum is carcinoma scirinus, that's the stomach. Carcinom adenostom from adenocarcinoma of stomach. Carcinoadenovesica, papillary adenocarcinoma of the bladder. Carcinosin pulmonale from pulmonary cancer, and carcinosciri mammae, scirrhus of mammae. So scirinum or carcinominium, the nosode of scirrhus cancer. Clinically, it is used for cancer of the breast, for cancerous diathesis, for glands which are cancerous or which are enlarged, for hemorrhages, worms, and varicoses. And also, scirinum can be used where tucrum marum verum and sina has failed. So tucrum marum verum also is a good remedy for worms. And Sina also is a good remedy for worms. Generally, most of the physicians give Sina. However, Tucrum marum verum also has good symptoms, whereby there is itching of the anal region at night. And if you examine the anal region, you will find small boils around the anal region or on the buttocks area. This is a very important objective symptom in order to prescribe Tucrum marum verum. And of course, carcinosin, as you all know, there's a fear of cancer and a strong family history of cancer. Now, pathology, next point is pathology helps us to individualize the case. So, individualization is given in Organon in FL number 153 to 154. It means to discriminate, to distinguish, to characterize, or to particularize. That means what? In individualization, what are we doing? We are giving the personality a special distinguishing character, or we are discriminating one individual from the other individual. So it is a qualitative difference at the level of identifying the individual. So two individuals may have the same symptoms, they may have the same disease, but they may have different symptoms. So these different symptoms will qualitatively give the difference of identifying the remedy. As you all know, individualization is the essence of homeopathy. It makes homeopathy a super specialization and is the only pathy which individualizes the case. Now it can be defined as the method of determining of the most striking, singular, uncommon, and peculiar symptoms in a diseased individual, differentiating him from other individuals suffering from the same disease. So out here, in individualization, what are we doing? In short, we are taking the PQRS symptoms. It is the aggregation of the characters which is influenced more or less by the environment, which determines the individual reaction. So how will the reaction, how will it take place? It will take place between the host and the environment. Environment can be internal environment as well as external environment. So the internal environment of the host is all the normal physiological processes of the body, like digestion, respiration, assimilation, anabolism, catabolism, so on and so forth. And external are the environmental factors, which I've told you, physical, chemical, biological, and psychosocial, cultural. So how the patient reacts and how do we aggregate all these PQRS symptoms, that will help us to determine the individual reaction. So now, who do we individualize? We can individualize the disease, the patient, the drug, and our homeopathic posology. Now let us see in short something about each. In the disease. So in the disease, how do we individualize the disease? Number one, you have to see the evolution of the disease or the sequential evolutionary march of events occurring in a patient's life. Identify the phase, see the symptoms which are characteristics, and see whether any concomitants can be taken for consideration. In the patient, you see the chief complaint, the concomitant, the mental symptoms, and these are the three areas where differentiation can occur. Example, two persons suffering from the same disease but different remedies are to be given. So let us take a simple example of a common cold. Two people come to the homeopathic physician for a common cold, and each one of them will get a different remedy. Why? Because the patient will react in a different manner. So it is the aggregation of the characters influenced more or less by the environment which will determine the individual reaction. So this point we have to take into consideration. So the two people are there having the same disease of common cold, but the medicine is different. Why? Because their symptoms are different, because they are reacting to the environmental as well as the internal causes in a different manner. So therefore, the totality is taken, each having two separate totalities and two different remedies. Then the drug. Take for instance the two remedies, Sequel and arsenic. Now both of them are chilly. So in Sequel, though he's chilly, he wants all the covers off and he wants the cold air. And in arsenic, he wants very hot things. Thus, we can identify the two remedies at one go. Now for posology, here you have to individualize the potency and the repetition of the remedy. So what potency to give, how to repeat it, all that also has to be individualized according to the case in hand. So the potency can be selected as per the state of susceptibility, and it's always good to remember that potency is has a direct relationship to the state of susceptibility. That means what? If the susceptibility is high, give a high potency. The susceptibility low, give a low potency. How do we identify the state of susceptibility? I've already told you the 7 points. That summation of the 7 points have to be taken, and then you can identify the state of susceptibility and subsequently its potency. And repetition also should be done in an individualized manner. Generally speaking, in an acute case, we frequently repeat it, and in chronic case, it is an infrequent repetition. But again, this will depend upon many factors of the case, upon the speed of the disease, the depth of the disease, the pathology of the disease, the direction of the disease, and so on and so forth. Okay. Next point, pathology helps decipher the auxiliary line of treatment. So the word auxiliary comes from the Latin word auxiliaries, meaning helpful. A synonym is extra, it is also known as extra remedial measures. It is given in the last part of Organon, aphorism 288 to 291. It means that besides administering the remedy, what else will you do in order to give relief to the patient, or how it can help in a complementary manner? That means what? Besides you're giving whatever similimum you're giving or the homeopathic remedy you're giving, according to the symptom similarity, what else can you do in order that the patient will be relieved besides the medicine? So that is known as the auxiliary line of treatment. Now, what are the types of auxiliary line of treatment as given in Organon textbook? Mesmerism in aphorism 288 to 289. It is done where the vital force within the organism is deficient, and other parts where the vital force has accumulated too much. So either the vital force is deficient in one part, system, or location, or it is excess. Okay, it's all described in this aphorism. You can go through it. Then massage is given in 290 aphorism. In massage, what happens? It arouses the life principle to restore the tone of the muscles and the lymph vessels. So lymph vessels are roused into activity, and the muscle tone is restored. Magnetism, given in aphorism 287, powers of the magnet can be used for healing purposes as per the symptoms of the north or south pole of the magnet. So the magnet has certain properties. The north pole of the magnet and the south pole of the magnet, it has different symptomatology. So unwanted or excessive effects can be antidoted by application of a polished plate of zinc. So out here in magnetism, if you are putting the magnet according to the symptom on a part of the body, according to the north or south pole of the symptoms of the magnet on the part of the body, and suppose you have kept it for a very long time, then it may have detrimental effects on the patient. So in order to remove the bad effects or the excessive effects of magnetism, Dr. Hahnemann has said an application of a plate of polished zinc will suffice. Electricity and galvanism 286, it acts less powerfully on the life principle and is used in diseases with abnormal sensation and involuntary movements. So patient has tics, he has involuntary movements like athetosis, etc., etc. Then electricity and galvanism can be used. Now baths, they can be used as palliative in acute and chronic diseases. So baths were especially rather misused in Dr. Hahnemann's time, where the antipathic or the enantiopathic treatment of medicine for skin disorders, they used to ask the patients to have these baths of sulfur. So the patient was immersed in a tub which had the sulfur chemical in it, and initially patient felt better, but later on they aggravated the skin condition, and it drove the skin disease deeper into the organism from the periphery to the center, from less important organs to more important organs, from the serous membranes, from the mucous membranes to the serous membranes. So out here, baths had a detrimental effect in the long run whereby the disease was interiorized, or it went from the superficial level to the deep level, from less important organs to the more important organs. And if you read the Organon, he has also said, Dr. Hahnemann has also said that the proof of this will be seen in the graveyard, where you will see so many people are buried in the graveyard after taking such baths. Okay, so however, it can be used as a palliative. Dr. Hahnemann says that a lukewarm water bath at a temperature of 25 to 27 degrees R. Here in the, if you see in the 290 aphorism, he has given this degree R. Now, have you all ever asked your Organon teacher, what does R mean? Or, or has the teacher told you, what does R mean? It means rumor. That means what? If you convert it, it is 32 to 34 degrees Celsius. And it is used in cases where the nerve fibers have become a benumbed sensation is there. So Dr. Hahnemann is advising only lukewarm water baths without any chemicals added to it. And that makes a great difference. Cold water baths at 6 to 10 degrees R, that is 7 to 13 degrees Celsius, are used in cases where cases of deficient vital heat or the tone of the muscle is exhausted. So cold water baths where there is deficient vital heat, or there is less tone of the muscle, or the muscle is totally limp and it is totally exhausted. Next point, pathology helps to determine the genus Epidemicus. Here the reference is given in aphorism number 100 to 104. It's a part of case taking of an epidemic disease. Out here, Dr. Hahnemann says, always treat each epidemic disease as a unique one. Do not try and compare it with any similar epidemic of the past. Always select a remedy that covers the pathology of the case, and that is remedy should have the capacity to act deep enough to touch the pathology. So whatever remedy you are selecting, see that it covers up the pathology. That is very important, otherwise it will not work. The pathology helps to determine the prophylactic remedy. So Homeopathic Prophylaxis by Arthur Hiller Grimmer is a good book whereby you can read. He has given a lot about the prophylactic remedies. So preventive medicines occupy a prominent place in today's world. The law of similar not only excels in power to cure, but excels more certainly in the art of disease prevention. So you can also give it to prevent the disease. Very true in today's scenario of COVID-19, whereby we are seeing different pathies are giving different medicines as immunity boosters or preventive. One of them is homeopathy also. So Government of India, Ministry of Ayush has said that arsenic album 30 should be given as an immunity booster, or it may act as a preventive. However, different doctors have the different views of different remedies. Homeopathic law provides specific remedies for specific disease conditions. So if you read this book, he has given many examples. For example, belladonna for scarlet fever, diphtherium and mercurocyanum for diphtheria, carbovage and cupromet for whooping cough, Lateris sativus and gelsemium for poliomyelitis, variolinum for smallpox. Melandrinum is the most potent antidote to the dangerous septicemia, and Thuja is the best antidote against chronic effects of following vaccination. And 13th point is the pathology helps determine the diet and regimen. So it is given in Organon, aphorism number 259 to 263. And he has given you an example of an acute and chronic diseases. Say in acute disease, say of tonsillitis, aphorism 262 to 263, he has given you an example. Rather, he has given you the diet and regimen, what is to be followed in an acute disease. I am giving an example of, say, tonsillitis. Suppose in a case of tonsillitis, patient wants cold water. So can you give it to him? Dr. Hahnemann says, yes, provided it is within moderate bounds. So he shouldn't overdo it. But why does he take it? Dr. Hahnemann says he takes this cold water because he is relieved by it. So therefore, in an acute case, the patient will only desire those things which gives him relief. Therefore, Dr. Hahnemann says whatever the patient wants, you have to give it to him in an acute disease, provided it is within moderate bounds. He clearly states that provided it is within moderate bounds. Okay, and also if the patient is comfortable by covering himself up, he will do it. So allow also covering. In hot weather also, the patient may want a covering around the neck, or he may want the ears to be closed with by putting cotton wool in the ears, or by putting a scarf around the neck. You can allow that. Why? Because the patient feels better. So whatever he desires in the diet and regimen in an acute case, you have to give it, provided, I repeat, it is within moderate bounds. In a chronic disease, in the big footnote 140, he has given you the various foodstuffs which have to be avoided, like medicated soups, radish, then roots, and spices, and so on and so forth. He said it has to be avoided in a disease. So example, chronic kidney disease is there. So doctor, if you read this footnote, big footnote, he has given you around a big paragraph of what is to be avoided, and even the regimen he has given you, what regimen to follow. So if you go through this, it'll be very clear to you all. So he says that in regimen, the heated rooms, woolen clothing next to the skin, a sedentary life in close apartments, the frequent indulgence in mere passive exercise such as riding, driving, or swinging, prolonged suckling, taking a long siesta in a recumbent position in bed, sitting up long at night, uncleanliness, unnatural debauchery, innovation by reading obscene books, subjects of anger, grief, or vexation, a passion for play, overexertion of the mind or the body, dwelling in marshy districts, damp roofs, punished living, etc. All these things must be far as possible avoided or removed. Okay, you can go through that. You can go to the Organon aphorisms in the footnote 140. Many more examples have been given. So this is all what I want to say, and I've concluded the chapter on general pathology of homeopathy. So it has covered up vast areas of different sections of Organon, right from man in health to man in disease. What is equilibrium? What is disequilibrium? What is health? What is disease? What is susceptibility? What is miasm? What is the prophylactic remedies? How to identify the remedy reaction, etc., etc. All that we have covered up. So we have covered up a vast variety of Organon in bits and pieces, but at a good level, so that you all can understand this. So in the examination, if they ask you a question about general pathology of homeopathy, you can take some of these points and you can write it down in a very condensed form. So I hope you all have enjoyed my lectures, and most important, hope you all have benefited in some way or the other. So if you haven't still subscribed to my YouTube channel and you're the newcomer who is seeing this, please do subscribe, for it is never late to subscribe. Thank you so much, and I hope all my videos of my lectures will be beneficial to